So I'm Jade Erwin, I'm the Digital Integrations Manager at Source LDPath. So today I'm going to be talking to you about a bit about Source LDPath, some case studies that we've been working on. We've got a really hot off the press case study that we've gone live with this year, so it's only February, so shows how recent that is. And then also the capabilities when it comes to digital integrations. I know it's been mentioned in that panel discussion that we can't lose sight of the work that we're doing. It's got to have an impact on the patients, and hopefully after this presentation you'll see the impact that we're having on the patient pathway, which is fantastic. So this is me. So this is Source LDPath. So we've got 3 sites. We've got our head office at Nottingham, and we've also got a site in Chichester. This is where our histopathology services run out of and where our digital integrations sort of come into play. We've also got a site in Cambridge, our genomics centre. And just to make it really clear that we're UCAS ISO 15189 accredited as well, which is something that we're really proud of. So a bit about us, we support over 90 NHS trusts and counting, so that's a significant number, and we like to say that we sort of create partnerships as opposed to just being an outsourced provider. We've got over 280 consultant pathologists on our books that report. Majority of these are digitally validated as well, which has an impact on our turnaround, a positive impact on our turnaround times, and also gives us that reporting capacity when it comes to digital integrations. We've processed over 350,000 cases in the last 12 months, which is a significant amount, and this equates to over 1 million slide scans. So as you can imagine, our scanners are working around the clock. We've got a proven expertise, so quite a lot of you here are actually trusts that we work with, so it's great to see you here, and you'll be able to see from our TAT reports that we've got with you that we're reaching an average of 90% of our TATs, which is fantastic, and with the digital integrations we're going to be excelling that, which I'll be able to go through in this presentation. As well as the end-to-end, so we process WETS histopathology samples right through to reporting. As part of that service, we can also do glass to reporting as well, so it's just wherever you've got the pinch points in your laboratory that we can help support with. Part of that, we've got a dedicated courier team, so if you need boxes to ship slides to us, or if you need barrels, that's all incorporated in the service. When it comes to the digital integrations, we've got a dedicated integrations team. I'm not technical in the slightest, so this is where we rope in our integrations team to sort of talk with your IT departments in terms of what integration would work for you. We've also got a customer care team, which I think is really important. So as part of offering this service, we offer like weekly, bi-weekly or monthly calls where we regularly check in with our trust that we work with to chase cases, or if there's any issues, checking on capacity and things like that. We've got a laboratory information management system, which is really important to mention. So this is custom built that we've created, and it's designed by pathologists for pathologists. This gives us that flexibility to be able to collaborate and work with other LIMS providers when it comes to integrations. Because we've built it ourselves, we can adapt it, so there's no red tape that we've got to get over. We can make things work quickly. It allows us for reporting faster, so it's a lot more streamlined, and case management and things like that. So it's a really bespoke LIMS that we're using. So why go digital? So there's quite a lot of information on this slide. So the bottom part of the slide is the traditional process. So this highlights sort of where the pinch points are in terms of delays when outsourcing cases to us. So in terms of receiving slides through to digital, you've got to package up the slides, you've got the courier delays. If the case gets reported and it needs additional lab work, you've then got to wait for the trust to stay them up and send that to us. So that can have a negative impact on turnaround times. Once we generate the reports, I've gone to some trusts where we're doing fantastic on our internal turnaround times, but once we generate the reports, you've then got a list of, like a pile of reports where you've then got to manually transfer that report into your LIMS, which it sort of has a negative impact. So all the benefits of outsourcing is lost. So you've got that administrative pressure once we've done the reporting. But with digital integration, we're sort of tackling, sort of enhancing our turnaround times, but we're also focusing on how quick can we get those cases to us, and how quick can we get the reports back into your LIMS system. So we're focusing on like the before and after we've processed the sample. So we're working as like a partner with our trusts. So we're really tackling reducing that courier time, the administrative pressures, and sort of trying to streamline that outsourcing process. What's really important is we want to remain completely agnostic. So there's different types of integrations that we can do. So we want to remain completely scanner agnostic, and this is achieved through using our Indica Halo IMS. So that can receive digital images from any platform, any scanner. So I2 Syntax, MRXS, any file format, there's no conversion required. So that's a recent change that we've made in our sort of digital setup. We're also IMS agnostic, so I'll go through some partners that we're working with. So that streamlines how you can outsource your cases from your IMS. We're also LIMS agnostic, so we've got a couple of LIMS providers that we've worked with to be able to get order messages and reports back into your LIMS system, and that's growing as well. We've got other LIMS providers that we're working with. So in terms of the IMS integration, we work with Sectra and Fujifilm. So this allows us to be able to get images a lot more easily through the cloud, and it's just that quicker referral of cases to us, so it's a lot more sort of user-friendly. The slides and the patient information come together, so it makes it a lot easier for transferring that information. Just a couple of LIMS providers that we work with. So we've got the capability of doing a Clinicist plugin. So that's being able to do an order message directly from the Clinicist LIMS and getting the reports back into your LIMS system. We've also got a live integration with Apex. So again, it's a seamless transfer of cases, faster turnaround times, and just really improving that pathway. If you don't want a sort of tight LIMS integration, we have got an interim solution as well. So we work with a third-party company called Talking Point, and they've got something called a Path Exchange, which is an import module. So what that does is you'll purchase the software from Talking Point, that's installed on a PC, and then that basically automatically transcribes the PDF data that we do in our histopathology reports into your LIMS. So how it does that is we'll provide you with a PDF version of the report as well as a text file, and it's magic how it works. It basically just transfers that text information directly into your LIMS. You can also add flags on there as well, so if you've got like unexpected findings or you want to raise certain cancers based on the SNOMED codes, that can be incorporated into that. And it just eliminates that human error, and obviously you can then utilise staff to do other things rather than having a member of staff copying and pasting the reports. We've actually got some stats in terms of how much time this has saved. A few of our trusts have actually used this as part of like a business case to be able to justify installing Talking Point. So before I go on to the next slide, this is hot off the press. So we've recently gone live with a digital integration at the end of January, and this was a data file transfer integration as opposed to an IMS integration, and this is focusing on the pre-prepared workflow. So slides to digital, it's actually gone from digital images coming to us. So before, on the top level is us receiving the glass slides. It's obviously got to be shipped to us. We've got to unpack, book it in. It's then assigned to our pathologist, and then we generate a report. Our turnaround time for pre-prepared is typically 7 days. So that just gives you a sort of timeline that we're traditionally working towards. However, with going live, this has been a completely managed project as well. So we're sort of scaling up for going live. So this data is based on 171 cases. The slides are scanned first thing in the morning. They're then added onto our IMS through the data transfer and the portal. These are then able to be assigned to the pathologist, and we've got 59% of these cases had a same-day turnaround time. 75% of these cases had a next-day turnaround time, with an average turnaround time of 0.99 days. So that is just incredible, and something that we've fed back to the team, to the trust that we're working with, just to show that how this integration is going to have a significant benefit on that workflow. And I joined a call with the trust, and they couldn't believe that the digital slide that they'd scanned that morning, there was already getting the request for additional lab work on that same day. So it's just absolutely phenomenal. We've got previous case studies as well. So we've got a LIMS to LIMS integration. This is based on 11,000 cases reported in 2024. We managed to reduce that from 9 days down to 5, from procedure to outsourcing. We've got a scanning integration. This was based on 6,000 cases in 2024, reduced from 7 to 3 days. And then we've got a combination of the LIMS integration and scanning, and that was 14,000 cases from 18 days to 4 days. So it just shows that these digital integrations, how much of an impact it's having on those turnaround times. So just some feedback from our pathologist. We wouldn't be where we are without them. So if you want to, this is just a snippet of some feedback that we've got. So if you visit us on our stand, we've actually got the full feedback if you want to come and take a picture. But they've quoted that it's a high level of quality control that we offer. We improve turnaround times. We're a national leader, and that's something that by having these multiple types of integrations, we're continuously learning, and being a market leader, we're being able to sort of adapt, and we want all trust that we work with to be able to have this service. And then we've also got obviously this bespoke internally developed LIMS, and we've got lean workflows, which is obviously fantastic. So why use Source LDPath? So as I've said before, we want to be a partner as opposed to just an outsourced provider. So once we start an integration project, we've got a project management tool that we sort of track the project progress. Because there's nothing worse than starting a project and not knowing sort of what needs to be completed by each party. It's got to be a collaborative approach. We're really keen on doing integrations but doing it safely. So we do end-to-end validation testing, so we do the technical testing, we then do clinical sign-off, so we send some validation slides to the trust, they come back, we get an external pathologist to sign that off to make sure that it's clinically validated, and then we have an internal clinical sign-off as well, and what we'll do is we'll complete this UAT and send it on for you for evidence as well that the integration has been completely validated, and it keeps UCAS happy. As well as this, although we might have an integration with you already or we're planning to, we offer continuous support as well. So going live with this recent trust, we've got regular catch-ups, we'll have a look at future development as well. If you've already got an integration with us, how can we better improve? So you've constantly got that support going forward. And our main message as well is we want to make outsourcing feel in-house. So you could argue that with an average of 0.99 days, outsourcing a digital image to us for reporting, it could be just as quick as going down the corridor and putting it under the pile of your cases that your internal pathologist is reporting. So we want to make it feel in-house. So we've got a stand outside, so if you want to learn more information or you want to sort of connect with us and have a look at sort of the capabilities that we can do with you, feel free to come and have a chat. And yeah, thank you for listening.